This video is about this video is about a condition called retinoblastoma. So in our country, Bhutan, retinoblastoma is overall is a very rare condition. It's very rare, and in a country like ours, a population of 7 lakhs, it should be very uncommon. When I was training and all, the center where I was training, it had so many retinoblastoma cases because India is a large country, huge population, and there were lots of patients coming, and the center was really it was a kind of a retinoblastoma center, so a lot of patients were being referred there, and also treated very well. Some cases we could see it was a late presentation and all. Some cases very early, which was a good thing. We could treat and save the patient, even sometimes save the vision, not only save the eye. So in our case, in our country, when I came back, I came across one case, and that case was referred to India, and they enucleated one eyeball. So things that our country doesn't have a kind of well-developed cancer facility. So in order to whether we diagnose and grade and group retinoblastoma, still then we need oncology management, which is not that big here. We don't have an oncologist in our country, so we have to refer, especially our referral center is in Chennai. So there they managed that baby after enucleating, and they did some chemo. The baby underwent chemotherapy. Right now baby is being followed up. One is anatomic socket, other one is group ARB. So that one was lasered, and the baby is doing just fine, very fine. Indeed, he has a good vision in the seeing eye. So after that, it was 2 years since last week, and we didn't see any retinoblastoma cases in our country. So until last week, there was a 5-year-old girl, which actually at the age of 5 is very uncommon for retinoblastoma to occur. So not that it will not occur. So that child, thankfully, the relative of the child, auntie, saw something is wrong in that baby's eye, and the baby was squinting and all. So that they came to examine, and we found out there was a tumor in the left eye. So what happened was that the diagnosis of retinoblastoma made. Retinoblastoma, although Coats disease we have to rule out, but on B scan there was a tumor. On fundoscopy also we could see a tumor in the retina. And imaging we are planning, but since the diagnosis was made, and we do not want to deal with the unnecessary examination under anesthesia and all, since it will be done after she will be referred to India. So they will be going through many investigation, examination and all before starting the treatment. And thankfully the eye should be, we hope the eye is salvaged after chemotherapy, and yeah, they are still awaiting a referral. So we hope the best for the child. So it was good that she was there was 2 months of duration of the mother, the relatives saw that squinting 2 months back, but because of awareness and all, so there was a delay of 2 months. Still then they were smart enough, there was not much. After that they came to hospital, and we were able to find out there was tumor. So it's very important to be aware of this condition, because this condition is really dangerous condition. It's a silent condition. There's no pain, like the auntie was saying. There was no pain, nothing was there. She was shocked that this kind of condition is there. So this is a very silent disease until it becomes so advanced that it will present as pain, proptosis and all. So so people should be aware. Our health people should be also aware of this condition since it's in the children. So it is one of the most commonest pediatric ocular intraocular cancers, and our population and all, it can be less. It can be rare, and but people should be mindful that it can be there, especially if the baby suddenly there's an onset of squint, and suddenly if there's especially the most commonest presentation is white reflex. So baby can present with white reflex, which is known as leukocoria. And thankfully we have a good health system in our country, with every district and small places, villages having a health center, and health assistant, all they are all trained in eye and given the awareness of this condition, and we have given equipments to screen that also. So we are doing just fine, and but we have to be mindful. So this needs to be known, so the child can be diagnosed early, and early treatment can be initiated. And just like people nowadays in Bhutan, like most of the children's parents are outside, so in this case also we found that the parents were outside, so parents had to come, and they will go with the child to India, and they will get screened. Usually in this case there is a genetic factors also, so genetics will play an important role in this condition. Hopefully the treatment will be done, and the eyes will be salvaged. Even the vision we hope to be restored. If it is restored, then it will be really a great success. So yeah, although this condition is very uncommon, we should be mindful, and that awareness responsible lies with us, the health workers. So yeah, I just wanted to let you know that in small country like Bhutan also, we cannot be complacent that such a small population will not have this kind of disease. So today's video was to make people aware that retinoblastoma is a dangerous condition, and people should be mindful and aware when they see some changes in the eyes of their children. Thank you.